Have you ever wondered just how safe your most personal information is when you visit a doctor or a hospital? We trust them with our lives, but what about our data? Today we're diving deep into a story that might make you think twice about digital healthcare records. We're talking about a massive data breach at Archer Health, where the private information of nearly 150,000 patients was left wide open for anyone to see. This isn't just about names and email addresses. We're talking about the most sensitive data imaginable. So, what exactly happened? Imagine a massive digital filing cabinet, but without a lock, left in the middle of a public square. That's essentially what occurred at Archer Health. They had a database containing the records of almost 150,000 patients, and this database was unprotected and publicly accessible online. It's a cybersecurity nightmare come to life. The person who discovered this vulnerability wasn't a hacker trying to steal data, but a security researcher who was essentially just checking for unlocked digital doors on the internet. He stumbled upon this treasure trove of information and immediately knew the gravity of the situation. Let's break down what was actually exposed. We're not talking about minor details. The leaked data included patients' full names, addresses, and dates of birth, but it gets much worse. Social security numbers were in there, which are the keys to your financial kingdom. And then there's the medical information, diagnoses, treatment details, prescription information, and even lab results. This is the kind of data that is deeply personal, the stuff you only share with your doctor in the strictest confidence. To have it all exposed is a profound violation of privacy. Think about the potential consequences. This information could be used for identity theft, financial fraud, or even blackmail. Imagine someone getting a hold of your sensitive medical diagnosis and using it against you. It's a terrifying thought, and for 145,000 people, it was a very real possibility. The story does have a silver lining, albeit a small one. As soon as the security researcher found the exposed database, he did the right thing. He didn't try to profit from it or share it. Instead, he immediately notified Archer Health. This is what we call responsible disclosure in the cybersecurity world. It's about helping organizations fix their security holes before malicious actors can exploit them. Once Archer Health was alerted to the massive vulnerability, they acted quickly to secure the database. They essentially put the lock on the digital filing cabinet that should have been there all along. The database is no longer publicly accessible, and the immediate threat of anyone just stumbling upon it has been neutralized. Now for the question on everyone's mind: did the data fall into the wrong hands? This is the most critical part of any data breach story. So far, the investigation has found no evidence that the data was copied, downloaded, or distributed on the dark web. The dark web is the part of the internet where stolen data is often bought and sold by cyber. If this information had made its way there, the damage would be almost impossible to contain. The fact that, as of now, there's no sign of it being sold is a huge relief. However, we can't be 100% certain. The database was exposed for an unknown period of time before it was discovered. It's possible that someone else found it before the researcher did. That's the scary unknown in this situation. So, how does something like this even happen? In the world of cloud computing and big data, configuration errors are a surprisingly common cause of major data breaches. A company might set up a new database or server and simply forget to enable the proper security settings. It can be as simple as a single checkbox left unticked or a password not being set. A simple human error can lead to a catastrophic outcome. In this case, it appears that the database was misconfigured to allow public access. It highlights a critical need for rigorous security protocols and double-checking every single step when handling sensitive data. This isn't just an IT issue, it's a fundamental patient safety issue. Let's talk about the bigger picture. Healthcare is one of the most targeted sectors by cybercriminals. Why? Because medical records are incredibly valuable. They contain a wealth of information that can be used for all sorts of fraud. A stolen medical identity can be used to get prescription drugs or file fraudulent insurance claims. A complete patient record, with a social security number, can sell for hundreds or even thousands of dollars on the dark web, far more than a simple credit card number. This makes hospitals and healthcare providers a prime target. They hold the data that criminals want most, and unfortunately, the healthcare industry has often lagged behind other sectors, like finance, in terms of cybersecurity investment and practices. For the patients of Archer Health, this is a moment of anxiety and uncertainty. The hospital is now in the process of notifying all 145,000 individuals whose data was exposed. If you were a patient there, you should be on high alert. These notification letters will likely offer identity theft protection services, and it is crucial to take them up on that offer. It usually involves credit monitoring and identity restoration services. This is your first line of defense. You should also consider placing a freeze on your credit with the 3 major credit bureaus: Experian, Equifax, and TransUnion. A credit freeze makes it much harder for someone to open a new line of credit in your name. It's a proactive step that can save you a world of trouble down the line. Also, be extremely wary of phishing attempts. Criminals who might have gotten this data could use it to craft very convincing emails or text messages, pretending to be your bank, your doctor, or even the IRS, to trick you into giving up more information. This incident serves as a wake-up call, not just for Archer Health, but for the entire healthcare industry. Digital records have brought incredible benefits in terms of efficiency and coordinated care, but they also introduce new risks. Hospitals and clinics need to invest heavily in robust cybersecurity measures. This means regular security audits, penetration testing where they hire ethical hackers to try and break into their systems, and continuous training for all staff on security best practices. It's not a one-time fix, it's an ongoing commitment. The cost of a breach, both in terms of financial penalties and loss of patient trust, is far greater than the cost of implementing strong security from the start. So, what can we, as patients, do to protect ourselves? We can't control a hospital's database security, but we can be more proactive about our own data. When you fill out forms, ask why certain information is needed. Do they really need your social security number for a routine checkup? Sometimes they do, but it's always worth asking. Be mindful of the information you share on patient portals and healthcare apps. Use strong, unique passwords for these accounts and enable two-factor authentication whenever it's offered. It adds an extra layer of security that can stop a hacker in their tracks, even if they have your password. We need to start thinking about our digital health information with the same level of care that we think about our physical health. In the end, the Archer Health data breach is a stark reminder of the fragile nature of our digital privacy. While we can be thankful that a responsible researcher found the flaw and that the data hasn't appeared on the dark web yet, it highlights a systemic problem. As more of our lives move online, the responsibility to protect that information grows. This story should pressure the healthcare industry to do better, to prioritize our digital safety as much as our physical well-being. And it should empower us, the patients, to be more vigilant and demanding about how our most sensitive information is handled. This is a developing story, and we'll be keeping a close eye on any new information that comes out, especially regarding the investigation into whether the data was accessed by unauthorized individuals. It's a complex issue with no easy answers, but awareness is the first step. Thanks for joining me for this deep dive. If you found this information helpful, please hit that like button and subscribe for more content that breaks down the important stories shaping our digital world. Stay safe and stay informed.